Come in.
Hi, Ashley. I'm Victoria. I'll be your nurse today.
Hi.
Hi. So how have you been feeling? What's been going on?
I came in because I got this stubborn cough.
Okay.
And I've had it for a couple weeks now.
It's
just
Alright.
it's starting to get annoying, I guess you could
Feeling
say.
any pain while you're coughing?
Yes, chest pain definitely.
Okay.
And I'm trying to. It's like I've been hacking up stuff, and it's just.
Okay. Has it
kinda
been pretty
painful
gunky? What's the color been?
Oh, of the stuff I'm
the stuff
coughing
you're
up.
coughing up. Yep.
Probably greenish.
Greenish. Notice any blood or any redness to the cough?
Kind of funky tinted, I suppose. Yeah.
Okay, kind of brownish. Okay.
Yeah.
Okay.
Yeah.
You feeling any fever or chills? Appetite?
You know, recently, yes, I've been feeling some chills lately. Not
Okay,
for
let me
weeks.
check your
but-
temperature. Okay, yeah, it feels like you have
Am
a
I-
fever.
Okay. All right. As far as the appetite goes,
The
yeah,
appetite,
I'm so weak lately. I don't get good sleep. I don't
Okay.
eat well. Everything's just been off.
Any weight loss have you been noticing lately?
I suppose so, because I haven't been eating more than soup. I mean, my
Yeah.
throat hurts and it's just terrible.
Okay, so not as much as you used to.
Yeah.
Alright, so I'll let the doctor know when he'll come in here and explain
Okay.
what our next steps will be to figure out what's wrong and get you back on your feet soon, hopefully.
Well, all right. Okay, sounds good.
Alrighty, thank you, Ashley.
Thanks. Hello?
Hi Ashley, my name is Dr. Woods. I'll be taking care of you today.
Hi.
So the nurse tells me you've been experiencing some pain with coughing, a little frequent tussis.
Yes, yes, very much.
Blood-tinged sputum, pyrexia, nocturnal hyperhidrosis, and weight loss. Those are the symptoms she said you were having.
I mean, I've been coughing a lot and just can't sleep and not hungry and all that. It's
Okay,
just
so
really
we're gonna do a couple tests. First, we're gonna give you a subcutaneous injection of a purified protein derivative.
Oh, okay.
And then we're going to also do an X-ray of your thoracic cavity, and we're gonna do a sputum lab test as well. How's that sound? All right, we'll have the nurse come in. You got any
Okay.
questions for me? All right, have a good day.
Okay. Come in.
Welcome back, Ashley.
Hi.
Your test results are in, and
Oh, great.
with that subcutaneous injection, you did have a positive test. You had a red protrusion at that injection site. That's not always accurate, so we did 2 more tests. The thoracic cavity X-rays. You had white spots in your pulmonary region. So
Oh, okay.
that's also a positive test, and then the sputum test had strains of tuberculosis in it, so you do have tuberculosis. So what we're going to do is we're going to put you on a 3 antibiotic regimen: rifampin, ethambutol, and pyrazidine.
Okay.
You're going to take those PO, BID, and they're going to be 3 mils per dosage. It's going to be a total of a 6-month treatment, but you're going to come in 2 months and then see how everything's going. You have to take them every day, otherwise you could die. So, do you have any questions for me at this point? Okay, that's fine. We'll send the nurses in.
Okay. Come in.
Hi, Ashley. So I'm Victoria, your nurse. I was with you a couple days ago
I
when you
remember.
were explaining your symptoms to me. Okay, so do you understand what the doctor explained about the tests we took and how we got the results?
To be honest, not at all.
Okay,
I
so
said something, but
okay, so let me explain. So first we did the little injection on your forearm,
yep, I remember that.
and then when we came back a couple days later, you had that red bump.
Yep, I remember it.
Yep, so that means positive for tuberculosis. It's
Okay.
not always accurate, so we did a few other things. We took an X-ray of your chest, and your lungs had white spots in them. It's a sign of tuberculosis also.
Okay, so I got 2 signs of it.
Yep, so then the last thing we did was test, it's called the sputum test, and the junk that you cough up is called sputum.
Oh, okay.
So we took a look at that, and we found bacteria for the tuberculosis in your sputum.
So that's it's for sure.
Yep, it's for sure. With those 3 things, you're positive for tuberculosis.
All right.
Alright, so now it's the treatment, how to get you better.
So there is a treatment. Good.
Yes.
Okay.
So did you understand what the doctor explained about the medications and how are you supposed to do this?
So he basically, for me, he listed off 3 different medications real
Yep.
quick, and then he said PO, BID, and that was it.
Yeah, okay. So there's 3 meds: rifampin, ethambutol, and pyrazidamine. You can think of REP. Rep.
Oh, okay. I like
3
that
meds you need to take for 6 months.
Okay.
And we said PO, that means by mouth. And then
Oh, okay.
BID, you'll be taking it twice a day,
I
morning and evening.
well that's much simpler. We should
Yeah.
have said that. Okay.
Yeah, that makes sense. Okay, so here's an example of one of the meds you'll be taking, and you'll be needing 3 mils of it.
3 mils. Okay.
So here's the syringe, and what I'd like you to do is you pull out 3 mils of air, inject into the med, invert it, and then pull out 3 mils.
Okay.
So can you show me the line about how much is 3 mils in
3
this?
milliliters here would be right about here, right?
Well, it's actually just a tad up, like a centimeter up.
Oh, I'm looking at the wrong line. Okay, right there.
Yep,
Right?
the top of the line with that.
Oh, okay, I got
Exactly.
you.
Yeah, that's 3 mils. Okay.
Okay.
So I'd like you to
Oh, I
show
get
me.
to.
Yep, you can administer your first dose right now.
Now I get
3
to
mils.
try it out. Okay, so here's 3 mils of air. Then I invert. Okay, squeeze it in. Then I invert it. Okay, and pull out 3 mils. You said
Yep.
3 mils.
Exactly.
Okay. And so does that look right?
There you go. You got it.
Oh, perfect. Okay.
And do you understand why it's so important to take this for 6 months and not stop?
No, I wasn't told anything about that. I just told to take it, and 2 months later we'll check up.
All right. Because with this tuberculosis, the bacteria will be feeling better in just a couple weeks. But if you stop taking your medication, there's still bacteria in your body, and it's gonna build up, get stronger, and it'll be much harder to fight off.
Oh boy. Okay, so what you're saying, just stick to it. Just stay
Stick
with
to it, yep.
Even when I'm feeling good.
Yep, exactly.
Okay.
Any other questions for me?
I think you answered a lot. You answered everything for me right now, at least, and I'll come back in 2 months.
All right, you got it, exactly.
Okay, perfect. Well,
All
thank you
right.
for that.
Thank you, Ashley. See you soon.
Okay.
Oh, what kind of symptoms have you been having lately? No, we're not doing that.
That's for sure. So you're gonna have to do that for 2 months, otherwise you could die.
What?
Okay, coming in.